Good evening, you're with Channel I, and we're about to kickstart another brand new episode of iMed. But this week we will be having a continuation of the topic that we discussed last week, which is about children and their mental health issues. So today we will be focusing on another targeted group, which given the current context of the country, can severely affect their mental health. So to talk about this, we do have with us Dr. Dulangi Dahanayake. She is the consultant child and adolescent psychiatrist at the Lady Ridgeway Hospital in Colombo. A very warm welcome and a very good evening to you as well, Doctor.
Good evening.
And Doctor, some might wonder, what is this said targeted group? Last week we did talk about pre-adolescent children, very small children. Now today we will be focusing on the targeted group of adolescents. So explain to me, Doctor, why are we actually focusing on this time period? Well, why is it special? Why should we talk about adolescence separately?
Yeah, because adolescence is actually a unique period. So if we go by the WHO definition, it's from 10 to 19 years, but it doesn't really encompass the richness of that period, because that is the period where actually a child goes from being a child to an adult. So it's a transitional period, and during this period a lot of changes occur. And adolescents also have a fascinating history, because in the in the early civilizations there was no adolescent period, because the human race had a lower life expectancy, and because by the time they were 12-13, kids were expected to take adult responsibilities, get married, to work in the fields. But as things improved, as healthcare and education and everything improved, we have developed this period into it has stretched out a bit more. Yes. And that's how the adolescent period sort of came into being. And during this period, like I said, there are lots of changes happening. One is, of course, the physical changes. So they are going through the pubertal changes. For the boys, that means they'll grow tall, they'll have the growth spurt, then their voices would change, and so many things change in their bodies. Yeah. And for the girls, there's breast development, and they attain menarche, and the body habitus change. So there's going to be a lot of changes for the girls as well. So in addition to these physical changes, there are lots of other things that happen. So their brains mature during this period. So if we were to look at the slide, you can see how the brain matures from front. So the front matures the last, the frontal part of the brain. So if you were to look at the slides, you can see the area in the front getting bigger as the child grows older. So it's a process that changes the connections between the nerve cells in the brain. And during adolescence, from the age of around 10-12 years, this maturation occurs. It starts at the back of our brains and it ends in the front. So the front parts of our brains are the ones involved with judgment, decision making.
Doctor, if you could explain why there is a color degradation?
Yeah. So the color is to show that the front part, the maturation. So in blue you can see the parts that are maturing. So the blue color increases as the child grows older, and in the last the last photo of the brain, you can see that the blue color is sort of covering a much wider area in the front of the brain also. So when we see kids, we wonder why sometimes they don't really think through their decisions, and they make, they're very impulsive. That is because of this development. Because the front part of the brain develops later, but their bodies are big, and their body habitus may be like an adult's, and then they are also they are very driven, and they have these hormones, and emotionally they are mature. They are, the middle parts of the brain are mature, so their emotions, their anger, their happiness, everything is they are able to express, but they are not able to sort of temper that with far thinking processes, making the correct judgments. So they can be a bit impulsive, especially when their peers are around.
Yeah.
So I guess one of the complaints that we get from parents of adolescent children are, they used to listen to us, but now they're just going with their friends and not listening to anything we say. That is also part of their development. So socially they are maturing. They are preparing to become adults and integrate with society. So that's part of the maturation that occurs during adolescence. And of course there are also going to be a lot of psychosexual changes. So they are going to wonder about their sexuality, their sexual orientation, and they are going to experiment with relationships and sexual activity. So all these occur during adolescence.
Definitely, doctor. We will get into that later. And I did want to ask you about what kind of specific behavioral patterns that you notice in children in their adolescence. What type of behavioral pattern?
Yeah, so as opposed to children, like I mentioned, they are more prone to hang out with their friends. There's less sort of obedience, I would say, to authority and their parents. So they want to sort of assert their independence. They want to do what they want. So there's a lot of conflicts with parents. So all those are normal behaviors. And then sometimes they may also do certain risky things like, driving vehicles without permission, and sometimes they even engage in a bit of, mischievous behaviors, playing pranks. So those are quite normal behaviors for adolescents.
I think you could classify them as adrenaline junkies as well.
Yeah, definitely. But then there are also certain problematic behaviors that might come up, and we have to be extra vigilant, and we really have to pay attention if the child is more withdrawn than usual, or the risks that they take are harmful to their physical or mental well-being, like experimenting with psychoactive substances like drugs and alcohol and things. And if they are behaving in a manner, like if there is sexual promiscuity, so those are risky behaviors that we have to pay attention to, because usually if that is going on, then the child is in need of some sort of support and help. And if they don't do, if there's a deterioration in their academic performance, if they are sort of getting into a lot of trouble at school, getting into fights, then of course we need to pay a bit more attention as parents and as adults in society and see what we can do to help them.
Say for example, doctor, now all the things that you mentioned just now, like the behavioral patterns, could you solely put the responsibility on the parent for not actually giving the attention that the child needs, or does the adolescent needs to own up to it and get responsibility?
Yeah, it's a mixture. So there's a role from parents as well, but then as the adolescent matures, there is a need to take responsibility and have some sort of control over their actions. And of course the society should also take some responsibility and support the adolescents, because it's a difficult period to navigate, especially nowadays. It's not there's such a lot of information coming, and there's a lot of conflicts, and especially for the adolescents it's a very tough period. We see a lot of children coming with distress and worries about the current context in the country as a whole. So there's a lot of problems for them at the moment.
Doctor, since you're an expert in the field, what type of psychiatric disorders have you come across when examining children?
Yeah, so in adolescents, of course, they may also have the developmental issues with their learning and other issues that are there in younger children. But specifically for adolescents, we see a lot of anxiety disorders like social phobia, where they have anxiety in social situations because they are very conscious, or they are very sensitive to how other people might perceive them. So they are more prone to develop social phobia. And then they may have other emotional disorders like adolescent depression. And then of course there may be a lot of, we do see kids presenting with self-harming behaviors. And then of course alcohol and drug use is another problem. And increasingly we are seeing adolescents with eating disorders, and then certain major psychiatric disorders like schizophrenia may also have their, they may start during the adolescent period, and that's also something we have to keep in mind if we see a teenager with change in behavior or deterioration in their school performance, or who have sort of withdrawn from society and is having crying spells or is hurting themselves. Then we have to be very vigilant.
I think parents who are watching today's show, or even adolescents, because they are in an age where they can actually comprehend something. So if you are watching the show, do take notes that you have to get proper medical supervision if you have any of these symptoms that the doctor mentioned before. Doctor, now I want to ask you, quite an interesting question now. How would you compare, what kinds of changes have you seen in a 90s teenager and a 2022 teenager? Because we have come across a huge revolution, I should say, a technical revolution, digital, in every sort. How would you differentiate a 90s teenager with a teenager who is living in the 21st century?
Yeah, I think there's been quite a change with time. In one aspect, I think the teenagers living in 2022 are experiencing a huge influx of information. So they have a lot of information at their fingertips. It's so easy to access information, be it studies, be it gossip, or even other interesting facts. So there's a lot of information available for them.
Basically an infodemic.
Yeah. And they also have a lot more freedom, I guess, in a sense, because culturally also there has been a change as the generation sort of moved forward. So they have more, I guess, more freedom. They are able to chat with each other online or connect with each other on social media.
I think, Doctor, what you're mentioning is stigma related to different kinds of aspects in society. Stigma has been a bit off, right?
Yeah. So there's less sort of, for example, in the 1990s, if there were friendships between boys and girls, that was generally frowned upon. But now it's more accepted, and people are freely having friendships and moving around without a lot of issue. But I guess in a certain sense, living in 2022 as a teenager is also a tough task, because there's a lot more decisions for them to make, and then their schooling has been disrupted with this COVID pandemic and other difficulties we are encountering. So those things have also really impacted on the well-being of adolescents. And in one way, like I said, it's a good time to be an adolescent, because you have a lot of information. You can make decisions based on a lot of information you get. But on the other hand, it's also tough, because you are expected to do certain things that the 1990s teenager wasn't expected to do.
I mean, given we're not talking about Sri Lanka to be exact, we're talking about the world as a whole, because teenagers in these times are very, you could say, updated and have more social maturity when it comes to dealing with society. And Doctor, what is your take on the parents' responsibility in managing the mental health of their child?
Yeah, so like I mentioned, parents have a huge role. Of course, the adolescent also needs to take some sort, there has to be some accountability for actions, but it's the parents who have to guide them and provide them support. So we can't suddenly start parenting when our child is 13 or 14. We have to start from the very early days. So that emotional availability, building up your relationship with your child, it has to start very early. And sometimes the situation where to draw the line between giving in and letting your child have his or her own way, and sort of putting your foot down and saying you can't do this. So that can be very challenging during adolescence. But if you have had a good relationship, if you have been able to negotiate, talk to your child and be open with your child, then it doesn't have to be a huge fight when he or she becomes an adolescent. Then of course you would be able to talk to them and support them and come to a compromise as such. But you have to always be vigilant, even though they are adolescents, even though they demand to have their freedom, they are still not mature enough to make certain decisions, and certain actions may be very impulsive. So it's important that parents do supervise their children, they keep an eye on what the kids are doing, but of course it has to be an open dialogue. You have to, sometimes you may have to put your foot down and say you can't do this, but sometimes you may be able to negotiate with the child. So it's, I guess it depends on what sort of relationship you already had with your child, plus what sort of temperament or characteristics that your child has.
I think, Doctor, like nowadays, especially given the current context of the country as well, online studies has taken place, and it has taken place all over the world. And what is your take on having that much of screen time for children, well, adolescents especially, because they know everything about how to manipulate a laptop, from even hacking their neighbor's Wi-Fi. I'm just kidding.
Yeah.
So what is your take on that?
Yeah, so online learning, I mean, some kids have really managed that well. They have managed to do their work and have had a good mix where they get support from their families and teachers, and they also do a bit of online learning, and things have worked out. But for some children it has been a big challenge. I guess it also depends on what sort of learner your child is. Some are visual learners, then some are what we call kinesthetic learners, then some of them have to sort of hear what is being told. So some of them need that physical interaction, the social interaction to learn, whereas some are okay to just watch a screen and learn. But then like you mentioned, there have been a lot of issues too, because kids have been doing up to all sorts of mischief when they are given access to devices. So one advice that we always give parents is to make sure that the device is something that's common to the family, and it's not a personal device to the child. Because if you like give ownership to a 13-year-old and you give over a phone and say this is yours, then there's no sort of reversing that. And so we encourage to have desktop computers if possible, and to have regular supervision, and make sure that this device is a family device, not just a personal device for the child.
Everyone.
Yeah.
And but again, it's very hard to draw the line between breaching the personal privacy of a child, of an adolescent, and actually giving the access that they need. And Doctor, if I may ask you, what type of common problems, not psychiatric disorders like we mentioned before, what are the common problems that you see, problematic situation that you see in adolescents?
Yeah, so some of the common ones are, of course, the screen usage is I think the commonest one that we are getting nowadays, because lots of parents come and complain, but then sometimes objectively the kids aren't really using it that much, but there are also certain kids who are using screens a lot more than they should be. So we have to find out what's exactly going on. And then of course this substance, alcohol and drug use is becoming a problem with increasing access. And then we get a lot of kids coming with mood swings. So there are anger outbursts and crying spells, and sometimes they are very happy. So they have trouble regulating their emotions. So we see that quite a bit, especially children being stuck home, not having access to leisure activities and their usual companionship with their friends. So those things create a lot of stress. And children do present with a lot of emotional dysregulation or mood swings. And then another problem is, of course, we get a lot of parents bringing their kids because they have started romantic relationships. So I wouldn't classify that as a psychiatric disorder, but it's a difficult thing for the parents to accept sometimes.
It's a good thing that you brought up the romantic relationships aspect of the child's mental health, because a lot of attention and controversy has been surrounding the LGBTQ community. It's a very stigmatized topic in Sri Lanka, I would say, but we have to talk about it in order to destroy that said stigma. What is the important function in adolescence in deciding one's gender identity or sexual orientations? What is the idea from a psychological standpoint on this?
Yeah, so during adolescence, children are trying to find their identity. So we call that identity versus role confusion. So they're trying to find their role in life, trying to find their identity. And when we speak about identity, it's mainly two parts. One is, of course, occupational identity. They want to decide what they want to do when they're adults. And the other part is their sexual identity. So they are trying to find their sexual orientation. And some kids go through a phase where they start worrying whether they are homosexual, or they wonder whether they are heterosexual or homosexual. And we have had instances where some kids have come to us in distress saying they are worried they are homosexual, because they are trying to sort of figure out exactly what their sexual orientation is, what their gender identity is.
And I mean, say for example, the said kid or the child or the adolescent makes the decision that they are homosexual or anything, but there is another problem pertaining to the society. What is the social response would be? What would their parents think? What would their neighbors think? What would their relatives think? How would you clarify that?
Yeah, it's a big concern and a source of distress for adolescents and young adults who do identify with the LGBTQI community. And I guess it's something that we have come to accept. I mean, across the world, it's increasingly gaining acceptance that these are choices that an adult makes, and that we have to respect their choices, and it's their body, so they are able to make those decisions. So I think as a maturing society, we have to be more open-minded and supportive and help them through their distress, because some of these young adults are in a lot of distress because of the stigma and the challenges associated with their sexual identity, so their gender identity and sexual orientation. So I think as a society we need to develop or cultivate tolerance and supporting attitudes towards them as well.
I think to all those viewing today's program, maybe a child, maybe an adolescent, maybe a parent, maybe none of those roles, I think that's something really important that we should emphasize on today's program on iMed. And Doctor, we have come towards the final part of the program as well. My final inquiry to you would be, what is your message to the general public who are watching today's show? What is your message to adolescents and their parents about dealing with the mental health issues?
Yeah, so what I want to emphasize is that adolescence is a very special period in one's life. So it's a period where you do have the abilities that adults possess, but you don't really have the adult responsibilities yet. So an adolescent can have a very enjoyable time, but they also need to work on their futures. They need to make sure that they don't waste their time on activities that are not fruitful or that are harmful to their mental and physical well-being. So the main message is that you enjoy your adolescent period, you let your child have a nice time, but still make sure that you guide your child towards healthier behaviors and healthier relationships.
I think, Doctor, when parents are concerned, they actually can think, they can put themselves in their child's position, think about their childhood and act accordingly.
Yeah, but that can still be a challenge, because the parents of adolescents nowadays had their adolescence during the 90s, and like we discussed, that there is a bit of a difference there also.
Yes, so I think that was a good message given out by the doctor to the general public. And with that, we have to wind up today's session of iMed. And thank you so much for joining in, and thank you so much, doctor, for joining with us. Because I think this topic, mental health issues, is quite prevalent in Sri Lanka, especially in children and adolescents as well. So thank you so much. We had with us Dr. Dulangi Dahanayaka, consultant child and adolescent psychiatrist at the Lady Ridgeway Hospital in Colombo. So thank you so much, doctor, again for joining with us.
Thank you, Sana.
And with that, we conclude today's show of iMed. Do stay tuned to Channel I and tune in next week as well for another episode, another disease on iMed. So with that, we say bye. Have yourselves a great rest of the day.